development of this chapter, we marked the following challenge. To determine the importance of the labrum pathology in the hip, describing its types of injury, which clinical data provide us a diagnosis and the arthroscopic techniques as an option for diagnosis or treatment of the labrum, discussing the best treatment method, whether debridement, repair, or reattachment. The importance of the acetabular labrum has been widely studied. The labrum plays an important role in the stability, increasing the acetabular surface area. The labrum acts as a seal, ensuring a more constant lubrication of the fluid film within the hip joint. Its valve effect helps to share the load. Okay, the prevalence of labral tears in patients with hip or groin pain is situated from 20 up to 55%. The impact of this pathology is its relationship with degenerative phenomena. The most common of all the lesions of the labrum is an anterior labral tear associated with an anterior acetabular chondral injury. The reason for the prevalence of anterior labral tear is that this region is subjected to higher forces or greater stress than other regions of the labrum. The clinical presentation is an anterior hip and groin pain. Impact activity often aggravates symptoms. This fact can be associated with other functional limitations. The most consistent physical exam found in patients with acetabular labral tears is a positive anterior hip impingement test. The hip rotation is the main limitation of ROM, although in many cases, the patients can be suffer limitation in hip flexion, adduction, and abduction. Radiographic evaluation helps us find structural abnormalities of the hip and pelvis. However, magnetic resonance arthrography is the best test for the diagnosis of labral lesions. Diagnostic image guide intra-articular hip injection can also be helpful in the diagnosis of labral tears. The arthroscopy, which is considered the gold standard, can be a diagnostic and a therapeutic resource. General or spinal anesthesia plays a main role to obtain an optimal muscle relaxation in order to minimize the amount of traction needed for distraction. The procedure can be performed by either a supine lateral or modified supine approach. No difference have been found in outcome regardless the access used. In this context, the actual line is limiting the capsulotomy to be as conservative as possible to maintain the stabilizing function of the iliofemoral ligament. Arthroscopic debridement may be an effective treatment for tears, but it has shown inferior results compared to labrum repair. Therefore, the role of labrum debridement has been unclear. In selected cases of stable labral tears, the labral debridement can allow a functional labrum. In these cases, the outcome of labral debridement produces favorable results comparable with a labral repair. To obtain a good labrum repair, the most important is to prepare it. An appropriate decortication acetabuloplasty of the rim is performed by preparing a bleeding surface for labral healing in the bony rim. Depending on the magnitude of the rim resection, the labrum does not necessarily need to be detached. The safety margin for anchor placement has been well defined using the acetabular rim angle. This angle is made by the subchondral margin and the outer acetabular cortex. This angle shows how much room exists to place a suture anchor completely in the bone. The rim trimming increase the rim angle, but if the drill depth increase, the rim angle decrease. The addition of curved drill guides and curved anchor prevent iatrogenic articular penetration. After the placement of the anchor, the suture configuration should be selected. If we compare loop versus pierce suture technique for labral repair, the results are statistically and clinically similar, and there are no significant difference in revision of failure rates. Then, to take home, the acetabular labrum plays an important role in the hip. In this context, the labrum plays a fundamental role in the pathological mechanism of the hip. Therefore, the role of arthroscopy in the treatment of labral tears is highlighted. To obtain a good labrum repair, the most important is to prepare it based on preparative imaging and intraoperative decision-making. You have to keep in mind that the outcome obtained from the hip arthroscopy don't depend on the approach system used. In this context, the actual line is limiting the capsulotomy to be as conservative as possible to maintain the stabilizing function of the iliofemoral ligament.